Have you ever wondered what diabetes really is and how it affects your body? Well, let's unravel this complex health condition together. Diabetes, often known as diabetes mellitus, is a group of diseases that influences how our body utilizes blood sugar or glucose. It's like having a high-octane fuel, but a faulty engine that can't burn it properly. There are different types of diabetes, but we'll focus on three main ones: type 1, type 2, and gestational diabetes. There are also several less common types, but we'll save those for another day. In the simplest of terms, the role of insulin in our body is like that of a key. It opens the doors of our cells, allowing glucose to enter and fuel them. But in diabetes, this key and lock mechanism gets disrupted. Type 1 diabetes is like a lost key situation. It's an autoimmune condition where our body's immune system mistakenly destroys the insulin-producing beta cells in the pancreas. Without insulin, glucose builds up in our blood instead of being used as fuel by the cells. On the other hand, type 2 diabetes is more of a rusty lock scenario. Here, our body either doesn't make enough insulin, or it resists insulin's effects. This resistance means that even though the key is there, it struggles to unlock the cell door for glucose. This is what we call insulin resistance. Then comes gestational diabetes, which occurs during pregnancy. It's like a temporary lock change that usually resolves after delivery, but may leave the mother with an increased risk of developing type 2 diabetes later in life. So now that we have a basic understanding of diabetes, let's delve deeper into the differences between type 1 and type 2. What distinguishes type 1 from type 2 diabetes? This is a question that has often stumped many. Well, let's delve into it. Type 1 diabetes, also known as juvenile diabetes, often starts in childhood or adolescence. It's an autoimmune condition where the body's immune system attacks and destroys the insulin-producing beta cells in the pancreas. This means the body can't produce insulin, a hormone needed to regulate blood sugar. It's like having a car, but without the fuel to run it. On the other hand, type 2 diabetes typically develops in adulthood, though it's increasingly seen in younger individuals. Unlike type 1, the pancreas in type 2 diabetes does produce insulin, but either not enough or the body doesn't use it effectively. This is what we call insulin resistance. Imagine having the car, the fuel, but the engine just doesn't work as it should. Now, what about risk factors? Both type 1 and type 2 diabetes have a genetic component. If a family member has it, your risk increases. However, environmental factors also play a significant role, particularly in type 2 diabetes. Things like obesity, lack of physical activity, poor diet, and even stress can contribute to its development. As for type 1 diabetes, while genetics do matter, scientists believe that environmental triggers, like viruses, might initiate the autoimmune process that leads to the destruction of beta cells. It's like a misguided security system, attacking the very things it's meant to protect. Interestingly, despite the differences, both types of diabetes lead to the same problem: an excess of sugar in the blood, which can cause a host of health issues if left unchecked. While they might sound similar, type 1 and type 2 diabetes are distinct in their causes and development. Understanding these differences is crucial, not just for those afflicted by these conditions, but also for those who aim to prevent or manage them. So, let's continue our journey into the world of diabetes as we explore its symptoms, diagnosis, and management. So, what are the telltale signs of diabetes? Let's delve into the common symptoms. Polyuria, or frequent urination, can be one of the first signs. The body's way of trying to get rid of excess sugar in the blood is to flush it out through urine, which can lead to dehydration and subsequently polydipsia, which is excessive thirst. If you're constantly feeling parched and your trips to the bathroom have become more frequent, it might be a good idea to get checked. Unexplained weight loss is another symptom. Your body might start burning fat and muscle for energy because it can't properly use glucose. Now let's talk about the subtle differences between type 1 and type 2 diabetes. With type 1, symptoms often appear suddenly and are more severe. They can include severe hunger, fatigue, and blurred vision. For type 2, symptoms might be milder and develop over a longer period. You may not even notice them at first. Identifying these symptoms early can pave the way for timely diagnosis and treatment. How can you confirm if someone has diabetes? Now that we've discussed the types and symptoms of diabetes, let's delve into the diagnostic measures that can confirm a diabetes diagnosis. Firstly, we have the criteria for diagnosing diabetes and prediabetes. Clinicians use a variety of tests to diagnose diabetes and prediabetes. Prediabetes is a condition where blood sugar levels are higher than normal, but not high enough to be classified as diabetes. The first test is the fasting blood glucose test. This test measures blood sugar levels after an overnight fast. A fasting blood glucose level of less than 100 milligrams per deciliter is normal, while a level between 100 to 125 milligrams per deciliter suggests prediabetes. Anything above 126 milligrams per deciliter on two separate tests indicates diabetes. Next, we have the oral glucose tolerance test, which involves fasting overnight and then drinking a sugary liquid. Blood sugar levels are tested periodically for the next 2 hours. A blood sugar level less than 140 milligrams per deciliter is normal. A reading between 140 to 199 milligrams per deciliter suggests prediabetes, while a reading of 200 milligrams per deciliter or higher after 2 hours points to diabetes. Lastly, we have the hemoglobin A1C or HbA1c test, which provides a picture of your average blood sugar control for the past 2 to 3 months. The results are given in percentages. An HbA1c level below 5.7% is considered normal. A level from 5.7 to 6.4% indicates prediabetes, and a level of 6.5% or higher on two separate tests suggests diabetes. Diagnosis is a crucial step in managing diabetes. It's important to remember that while these tests are effective, they are just tools. The real work comes in managing and controlling this condition through lifestyle changes and medical treatment. Awareness about these diagnostic measures can help in early detection and management of diabetes. What happens if diabetes goes unchecked, and what can we do to prevent it? Diabetes, if left untreated, can wreak havoc on various organ systems. The eyes, for instance, can suffer from conditions like diabetic retinopathy, where high blood sugar levels damage the blood vessels in the retina, potentially leading to blindness. In the kidneys, high glucose levels can lead to diabetic nephropathy, causing the kidneys to work overtime and eventually fail. Diabetes also has a significant impact on our nerves. Peripheral neuropathy, often experienced as a tingling sensation or numbness in the extremities, is a common complication. It's not just our peripheral nerves that are at risk, but our autonomic nervous system too, which controls our heart rate, digestion, and other automatic bodily functions. The cardiovascular system is another major area of concern. Diabetes increases the risk of developing heart disease, stroke, and other cardiovascular issues due to the high levels of glucose in the blood that can damage blood vessels and nerves that control the heart. So how can we avoid these damaging effects? It all comes down to prevention and management. A balanced diet low in processed sugars, regular exercise, and maintaining a healthy weight are key in controlling blood glucose levels. Medication may also be necessary, and regular checkups are vital to monitor progress and make any necessary adjustments. Lifestyle modifications alone can make a significant difference. Simple changes such as incorporating more whole foods into your diet, getting regular exercise, and reducing stress can go a long way in managing diabetes. Remember, prevention is always better than cure. Living with diabetes can be challenging, but it's certainly manageable. How? Let's delve into it. Pharmacological interventions play a pivotal role in controlling diabetes. Oral hypoglycemic agents, for instance, help to lower blood glucose levels and are typically used in the management of type 2 diabetes. These agents work in several ways. Some increase insulin production, others improve the effectiveness of insulin in the body or slow down the absorption of sugars from the intestines. In contrast, insulin therapy is often required for type 1 diabetes and sometimes for type 2. Insulin can't be taken orally as stomach enzymes would destroy it, so it's usually injected under the skin. But let's not forget about the advances in technology that have revolutionized diabetes management. Insulin pumps, for example, are devices that deliver insulin round the clock, mimicking the way a healthy pancreas would. These pumps can be programmed to deliver varying amounts of insulin based on your needs at different times of the day. And then, there's continuous glucose monitoring. This technology allows you to check your glucose levels day and night without the need for constant finger pricks. A tiny sensor measures glucose levels in subcutaneous tissue and sends this information to a device that displays your glucose readings. All these tools and medications, when used correctly, can help to maintain glucose levels within the target range, reducing the risk of complications. With the right knowledge and tools, managing diabetes can become a part of your daily routine.